Hello, everybody. Welcome to our new group, the Disability in Medicine Mutual Mentorship Program. This mentorship program is being launched jointly by the Stanford Medicine Alliance for Disability Inclusion and Equity, or SMADI, medical students with disability and chronic illness, or MSDCI, and the Society of Physicians with Disabilities, or SPD. It is being funded this year by the Stanford Medicine Teaching and Mentoring Academy, and its purpose is to provide support to healthcare workers and trainees with disability. My name is Suchita Rastogi, or you can just call me Suchi. I'm an MD-PhD student at Stanford and a co-founder of this program. I'm an Indian American woman with short black hair, sunglasses, and a striped blue t-shirt, and there's a sunset image in my background. The other co-founders of this program are Dr. Peter Poulos and Dr. Joe Kim, who you will see later this evening. Today's inaugural meeting introduces concepts of mentorship, particularly mutual mentorship, which is a core tenet of our community and is going to be the foundation of everything we do from here on out. Our guest speaker for this evening is Dr. Tom Caruso, who is an expert on mentorship in healthcare settings. Through the Department of Graduate Medical Education at Stanford School of Medicine, Dr. Caruso advises residency and fellowship programs on evidence-based methods to improve their programs, with a particular focus on mentorship. Dr. Caruso is a clinical professor in the Stanford Department of Anesthesiology, Perioperative, and Pain Medicine, and he has a master's degree in education for the health professional. Dr. Caruso, welcome. It is my pleasure, and thank you so much for joining us.
Awesome. Well, first, to get started, guys, I want to do a quick introduction. My name is Tom Caruso. I'm a pediatric anesthesiologist here at Stanford University. And I'm just extremely humbled and honored to be given this time with you guys this evening. I know that it is a late day, long day, and there's probably a lot of other places you guys could be. So I really appreciate your presence in this meeting and talk this evening for us. Just next slide, please. Today we're going to be talking about mutual mentorship. And you see on our agenda, we're right there around 5:50, right on time, the way Peter and his crew likes to run a ship, tight ship indeed. I'm going to talk for about 20 minutes. And then after that talk, we're going to jump into some breakout rooms. And like Pete has already mentioned, a lot of this is not only about the talk today about mentorship, but it's also about building community and building camaraderie. So when you engage in your breakout rooms, also see, although we have some topics assigned, it's also another opportunity to get to meet your peers. Next slide, please. So to get started off, I wanted to sort of define mentorship because mentorship is really defined in a lot of different ways. There's this guy named Brad Johnson out of the Naval Academy in Johns Hopkins who I really relate to the way he defines mentorship. He breaks it down into two main areas: career enhancement and psychosocial support. On the career enhancement side of things, it's providing protection and sponsorship and provision of challenging assignments to really help you advance your careers. On the psychosocial support, this is the aspect that we often lose out on, we don't think about. This is the idea of helping your mentee, which could be a peer, someone older than you, someone younger than you, helping them understand where they stand in this world and how to maintain a sense of wellness and a sense of being that puts them in a comfortable place in society. It's very, very challenging, particularly in medicine and the hierarchical structures within medicine, for people at all different levels to sort of feel comfortable with their station in life. And it's kind of funny, a lot of medical students and residents, they think, oh, once I get done and become an attending, then, that'll be done. But in fact, you become an attending and now you're an instructor, an assistant professor, and you've got folks who have been practicing for 30 years, and you're right back on the bottom of the ladder, if you will. So that sort of sense, that hierarchical structure will never really go away. So having psychosocial support as a part of your mentorship is absolutely key. Next slide. A little bit about mutual mentorship here. So mutual mentorship, and I have to give kudos to the excellent team who have brought you guys all together here today. Mutual mentorship is really a fantastic tool to have in your toolkit. It's a non-hierarchical developmental relationship based upon mutual reciprocity between two individuals. And I sort of detour, give a little bit of personal anecdotes here and there. In one of my first mentorship relationships as a faculty here was with a former faculty member who's very high up in administration in pediatrics. And we started off in a typical mentorship relationship. And we met every month and we did check-ins and he said, how can I help you? How are things going? And as my career advanced and him and I became better friends, our mentorship relationship morphed into more of a mutual mentorship, where even though he was a good 25 years my senior, he would often say, you know, Tom, I learn as much from you as I think you learn from me. I really appreciate your perspectives. I really appreciate how I started to help him think through things. And as he moved on in his career to a new position in another institute, we've maintained that relationship. So really trying to get away from the typical societal, academic, and structural hierarchical elements that some people see in life, and just sit back on some common humanistic terms of we're all humans trying to make it through, and that's how you sort of build a mutual mentorship relationship. They've studied mutual mentoring relationships, and you really can increase engagement and retention of your employees with this, and you build a lot of capacity for cross-training employees, because no longer is that one, a lot of times it's a senior mentor that everyone wants to get mentorship from that person. By squashing that vertical hierarchy and spreading things out horizontally, you can provide cross training for folks in a way that really spreads the good word. So it sounded a little bit like I was at church on Sunday spreading the good word. And then last, it really helps with succession planning through a lot of knowledge sharing. And this can be difficult because sometimes you might find yourself wanting to like, oh, I did this and I kind of want credit for it and I want to keep this internal into me. And something that I do in a whole nother life of mine is I provide immersive technologies for people and develop VR, AR. And one of our core values in the group that I lead is we're here to help support everybody. And when, you know, one person does well, all the boats in the bay rise. Like we're all in this together. So it's very important to try to take the eye out of what's going on and your accomplishments, and try to use your accomplishments to pull up those around you. And it'll be amazing what you can accomplish all together as one huge cohort. Next slide, please.
The audio description for this upcoming slide is: mentors are not there to make us happy. They are there to guide us to the best of their knowledge.
This is interesting. So a lot of folks would be like, oh, everyone should be a mentor. In general, different mentors, there are the idea that some people should not necessarily be mentors. And you've heard of this, the attending or the faculty member who's perhaps very well published or has huge grants, but they're kind of a jerk to work with. And I think we can probably conjure someone up in our mind at some point of our training that we've encountered like this. And sometimes what happens is we have this idea that everyone has to serve in this capacity to be a mentor. And in fact, that's not true. And it's important to look inside yourself and think to yourself, do I inherently enjoy being a mentor? Am I willing to take time out of my day to be in a mentor relationship with somebody? If you're someone where you don't inherently enjoy and you do it out of obligation, not only will that be, that's not good for you, but you'll actually be doing a disservice to your reciprocating mentee. And as a school of medicine faculty member, I hear like just today, I was speaking to somebody, and we hear all the time about medical students who have these mentors, and you can tell on the faculty side, they want to engage, they feel almost obliged, but they're really not into it. So look inside yourself, and when engaging in mentorship, you should be very deliberate in that, thinking I'm engaging in this mentorship, and it's time for, and I'm going to really give as much as they put in. Next slide, please. In general, as an overview of what mentorship provides in terms of career development, you are able to provide enhanced learning opportunities. You help prepare your mentee for professional advancement, sponsorship, which sort of Venn diagram overlaps with psychosocial support. Sponsorship is when someone is saying, you know, I heard Peter's not really that good at X, Y, and Z. And what your role is to say, yeah, well, you didn't know, but Peter's cat just passed away and he's been going through a lot. Okay. That's me being a sponsor for Peter, or his goldfish. I hope he didn't just lose a cat. That'd be really awkward. All of a sudden he starts crying. So it's very important to be that sponsor, and it doesn't have to be a hierarchical. I do this all the time with people at my own level, sometimes people older than me. Someone recently asked me how one of my bosses was doing, and I could tell he was fishing. And I have this saying, it was some of my mentees, don't take the bait. And I totally knew he was fishing. And I said, he's doing the best he can with the resources he has. He's learning. We're all learning. You know, just don't take the bait. Be a sponsor. And that's really can be a very key component of mentorship. I have something else I'd like to share. Just on a quick aside, discretion and professionalism, you put them together, it's discretionalism. If anyone's in a mentor, I made that word up just so you know, but so like if anyone's in a mentor relationships, discretionalism, knowing what to say and when, being showing discretion and being professional is one of the key things that you can really bring to mentor relationships, to not only model that behavior yourself, but also explicitly talk about how to practice discretionalism, because mentees will come to you and say, here, I'm in this situation. What do you think the right move is? And you can fall back always on discretionalism. How do we show discretion in this situation while remaining professional? So something to think about. Next slide, please.
The audio description for this upcoming slide is graphic cartoon of the left and right brain. The left side is in grayscale, and the left brain is surrounded by a word cloud containing left brain associated words in typefaces that are traditional. The right side is multicolored, and the right brain is surrounded by a word cloud containing right brain associated words in artistic fonts.
That has shown that if you identify a single person who you think of as a mentor, a buddy, like this is somebody who's going to really stand up for me, that just identification of that person in your workplace can overcome all your programmatic shortcomings. And what I mean by that is, let's say you're in a program, whether you're a faculty, medical student, or a resident, and your program has some shortcomings from your perspective that perhaps make your life a little bit less enjoyable. And if only you were in charge, you would make it better, those sorts of things. We know that if you take a cohort of people, and within that cohort, some of the people in that cohort have just a single mentor and the other people do not, having just that single mentor will completely change your mindset and your perspective about the entire program. And those shortcomings that seem very important to you at the moment, and those shortcomings that really sort of get under your skin and keep you up at night, they sort of start to fade away by the presence of a solid mentor, because it's that mentor that's going to keep you showing up to work the next day. Next slide, please.
The audio description for this upcoming slide is Erik Erikson's 8 stages of psychosocial development based on age group, portrayed as a staircase being climbed by a stick figure. The speaker focuses on stage 6, intimacy versus isolation, seen in young adults, and on stage 7, generativity versus stagnation, seen in middle-aged adults.
speaking about psychosocial support, this is a good time for everyone to sort of check in with themselves, to think about where you're at in your life. I took a guess that most of the people in this call would be either in the young adult or the middle-aged adult category. And this is Erikson's stages of psychosocial development. For what it's worth, some people are Erikson fans, other people are not. But I like things that are simple, right? Brad Johnson's definition of mentorship, psychosocial support, career enhancement, Erikson's stages of psychosocial support, right? So within this psychosocial development, when you're a young adult, you're at a point of intimacy versus isolation, per Erikson. So what does that mean? That means you're at this point in your life where new relationships are coming. Perhaps you've recently completed your training and you are looking to start an intimate relationship. Sometimes that comes in the form of partners and children. Sometimes that comes in the form of large groups of friends, family, groups like this. But there's some intimacy in your life. Now, the dichotomy, the opposite end of that spectrum is isolation. And some people don't quite find that intimacy they're looking for in life. And that intimacy doesn't have to be love, such as marriage. It's intimacy with people. And that's why I think this particular group is such a solid group, because it provides yet another avenue to provide the intimate connection between people. The reason why this is so important is because most trainees, if we're here, these are healthcare folks who we're talking with today, you've had a very unusual life, okay? You've had a very unusual life in that some people go to college, which has a big environment, but in our unusual life, we split up after college and we go off to medical school or DO school, some sort of training. And now that environment is much smaller. And you can probably look back and say, man, my best friends were in college. And your best friends are probably in college because we had, thousands of students. And of those thousands of students, I was able to curate a group of people I really liked. And then in medical school, we had hundreds of students. And then, you made some great friends in med school, right? But your pool got a lot smaller. And then guess what? We go through this crazy thing called the match, and we are torn out of these intimate relationships that are just being formed, and we're matched into all these residency programs. And now, not only have we just been scattered across the country, but now we have even smaller pools of people to choose from in terms of friendships. And those pools get smaller. And then some people are like, yeah, I have these friends in residency and we're friends, but your pool is growing smaller. And then sometimes you even get torn apart again during fellowship. And then when you come onto faculty, what happens as a faculty member is you may be one of very few junior, new, early career faculty in a division or department with not that many people with shared mutual interests. So because we're having all of these intimate relationships pulled apart every 4 to 6 years, right in our early adult career, it's very common for depression to hit us. And I suffer from depression occasionally, okay? And I think most of us going through this can probably think to some aspect of their life when they're feeling a little down and sad about things. And what can we do to sort of help that? Well, there's a lot of things, but one thing that really, really adds up is finding intimate relationships with people with common shared backgrounds. And that's why this is such a special group. Now, as you get a little bit older, you move into this area that Erikson calls generativity versus stagnation. And what does that mean? That means, what is the point of what I'm doing? Why am I here? I feel like every day I wake up, I get my kids, bring them to school, go to work, come home, get the kids, feed them dinner, put them to bed, do the same thing the next day. What is the point of life? Why am I here? And what are the next steps? And so with generativity, you want to be able to make sure that you have, you're leaving something behind. That's your hope, that there's a purpose to what you're doing and purpose why you're here. Stagnation is when you don't really feel that you're leaving that legacy. And sometimes that can also be a little bit hard to mentally overcome. And so the cool thing is that mentorship, whether you're at either stages in this part of your life, mentorship is going to either help you develop intimate relationships and or it's going to help you develop that generativity that Erickson talks about. Because I know that when I have mentor relationships with medical students who, guess what, are now in residency, and guess what, are now becoming faculty, although it may not be changing the world, for that one mentee who's now been moving along and we keep in touch, and I know that I have affected their life in a very positive way, that gives me that generational line. Now, one of my first mentors, and I know I have a few slides there, but I'm going to buzz through the ends because they're not as exciting. One of my first mentors, he once told me, he's almost passed away now. He's in his 90s. He's a physician. And he told me, he said, Tom, just remember, in the end, no one asks for all their papers to be brought to them. No one asks for all their money to be brought. Shower me in my monies. No one asks for that. You all want to be surrounded by your friends, by your family, and by your relationships. So if you can invest in anything in life, you want to invest in relationships. And if you invest in relationships, not just personally outside of work, but actually at work, that investment will help increase a lot of things, which we're going to talk about very quickly now. So next slide now. And then here's just a quick deeper dive into the benefits of mentoring. And this spans college through going into being attending. And these are all like published, these are guaranteed, like you're going to get this. In graduate school, you get higher GPA, you have a higher degree completion rate and much higher satisfaction. The high satisfaction when it comes across all the way. Mentors, mentees have greater eminence and productivity. For some people, this means a lot. They want to publish more, they want to get more publications and presentations, and having effective mentorship will definitively result in that. In terms of professional skill development, this is really cool. Direct teaching by mentors, it really has that provision of insider information. And you know exactly what I mean by that. It's like, hey, we really, this professor really likes using propofol, and that other guy really likes using sevoflurane when doing anesthesia. And then all of a sudden that mentee, when he's doing anesthesia or she's doing anesthesia, they feel like they look really good because they got this insider scoop on how people like to do their anesthesia. So this provision of insider information can really accelerate trainees. And it's really cool to watch this.
The audio description for this upcoming slide is infographic depicting benefits of mentoring, in which 3 text boxes are displayed atop an arrow pointing to the right. From left to right, the text boxes read, meet the players, gain organization influence, land first job.
This happened. It's really satisfying, I think. Network and employment, you get a better first job, higher paying first job. You really get to be in a position of influence. Confidence and identity. I had brought this up before, that you really help to increase your self-identity. And really cool study that came out of this one paper. They showed that the mentee develops a confidence that will sometimes even continue even the death of the mentor. And I can tell you that one of my first mentors I mentioned earlier, Dr. Jack Gwatney, who talked to me about like, hey, listen, invest in relationships because in the end, you're not going to ask for all your papers and money to come to your bedside. That will do nothing for you. He's probably going to pass away soon. And I will tell you that he's left a lifelong impression upon me.
The audio description for this upcoming slide is infographic that lists additional benefits of mentoring, including faster promotions, leadership roles within the university, and higher salaries.
Being these positions of influence. And I think because of that, and because I'm so fortunate to have some of the mentors I've had, one of my values is to make sure I pass that on to those coming.
The audio description for this upcoming slide is infographic depicting one person's influence spreading to many others. A single individual is connected to a series of progressively larger groups of people by multiple arrows.
Behind me. I talked about this a little bit. personal mentoring relationships outweigh programmatic shortcomings. So if you're in charge of a program and it's not getting a good rep, and you're trying to like fix this, we need less call, or we need more hours, or whatever it might be, you can actually invest quite heavily in mentorship. And generally that will lead to higher programmatic satisfaction. We've even seen that here at Stanford, some research I've done. Stress reduction, this goes without saying, offering appropriate work-life balance and modeling. It's really funny. Sometimes I'll have med students talk to me like, oh, Tom, you seem like you have such a great life. I'm like, oh, time out. I'm putting on a facade, like you have no idea, we're working 8 days a week over here. I say I'm not a good model of work-life balance. Right now I'm in my child's kindergarten classroom giving this talk because I was just doing a science fair for my second grader from 5 to 5:30, and then I have another meeting at 7 o'clock. I'm sitting in a kindergarten classroom, so not good work-life balance. And before we jump into these breakout rooms, how to operationalize mutual mentorship. So it's important to develop mentoring partnerships with a wide variety of individuals, including peers and senior clinicians. So don't just look hierarchically. Tailor your mentorship approaches to what exactly you're trying to get out of it, whether it's personal accommodation, so it's professional advancement, and seek these mentorship in specific areas of expertise. And like for myself, I'll think about my mentorship network and I'll think, oh, for this, I go to this person. For that, I go to that person. Benefits should feel very bi-directional. That's the definition of mutual mentorship. Doesn't mean you should not have traditional mentorship relationships, but in this setting, I want everyone to be open to being not just the mentor, but also the mentee. Even if you are at a more advanced station in life, just remember that there's something to learn from everybody. And I learned so much from, I happen to work with medical students a lot, and they teach me so much. I can't even begin to tell you how much I've learned from the medical students I work with. And traditional mentee has a sense of empowerment as an intentional agent of their own development. So you coming into the relationship on the mentee side should really think that it's not you're not just passively receiving advice and consultation. You're actively seeking it to.
The audio description for this upcoming slide is silhouette of two climbers, one pulling the other up to a rocky ledge. The caption reads, mentoring. Successful people never reach their goals alone.
Make the most of it. And what should your goals be? So in a let's say healthcare situation, you want to get to know the institution and understand the mission and culture. One thing that I tell folks is like, they're like, oh, I'm meeting with the chair. What should I say? Talk to them about, hey, what are the goals of the department? Like, yes, you're doing this work, but do they care? Does that align with the missions of the university, with the department? Try to see what their missions are and how they align. Really need to excel at teaching and research. And there's so many courses offered to help advance your teaching and advance your research, and finding the right pathways to have that mentorship in those areas will be key to your professional growth. Leadership, identifying pathways to build leadership within their local environments. This is always tricky, right? You've got those people in the positions that have been there for like 25 years. They must be 100 years old now or something. And you're like, oh my gosh, I'm never going to get that position. And this is great. Here's a great example, like residency director. This is like a common thing. They're like, hey, I'm interested in education. I want to be residency director. It's like that person's been residency director for 10 years and they're probably going to be it for another 15. There's so many other ways to bring education into your world. Let's think outside the box, through the GME, through undergraduate, through School of Medicine, through fellowships, and don't perseverate on just that one leadership pathway you may be thinking. Creating work-life balance, really, really crucial goal, and something you can try to get out of your mutual mentor relationships. And last is developing your professional network. So really want to seek guidance and excel in networking. And that may be internal to your institution or outside at a different institute. So don't limit yourself to just one area. And that's why this is such a great community you guys have established here. Because I know we have a lot of Stanford representation here, but there's also people from outside. And once you start to lean into those outside relationships, you really have a just shocking, eye-opening experience about how much excellent work is being done elsewhere. So last thing before we move into the breakout rooms, termination or continuation. In general, this is going to sound a little crazy, but in traditional mentor relationships, it's really cool to have like a set point where it's been a year and you can sort of be like, okay, we're going to re-engage in our mentor relationships. So we're going to have sort of a self-assessment and do we want to continue or do we not? And the purpose of this is because, and you can maybe remember some in your own mind, when you've had a relationship, a mentor relationship, and you sort of drift apart, and that's a sort of like awkward thing. Like I was doing some projects with that person, or I was kind of like cool with them, but we don't really talk, but they're supposed to be my mentor, but they're not really anymore because I've moved on to this. And sometimes it's self-evident and other times it's not. And so, you know, Zerzan published this great paper on mentorship, making the most of mentorship from like the mentee side, and sort of having a check-in every year, like, hey, you know, I've moved on to this, that, and the other thing. So I'm going to be, you know, hanging out with Ken and Peter now. And I really appreciate your mentorship from this last year. You know, we're still friends and all, but I want to let you know that I'm going to be like seeking mentorship from these folks because they sort of are more aligned with where I'm going in this direction, and just like kind of clears the air.